All right, today we're going to take a deep dive right inside the stomach to investigate something that really feels like a civil war raging inside of you, peptic ulcer disease. And believe me, this is way more than just a simple stomach ache. It's all about a delicate, crucial balance getting completely thrown off. You know that feeling, right? That burning, gnawing sensation deep in your gut? We've probably all been there. But what is really going on in there to cause that very specific, very unpleasant kind of pain? Well, let's get into it. Okay, so at its most basic, a peptic ulcer is literally a break, an open sore on the inside lining of your stomach or the very first part of your small intestine, which is called the duodenum. Just imagine your own powerful digestive juices, stuff like gastric acid and an enzyme called pepsin, starting to eat away at the very wall that's designed to keep them contained. It's kind of like the walls of the container starting to dissolve. So to really get how this happens, you've got to picture your stomach as this constant battlefield. Seriously, it's a place where you've got these powerful, aggressive forces in a constant standoff with some really sophisticated protective defenses. An ulcer? That's what happens when one side wins, and that delicate balance of power is totally lost. And this brings us to the two opposing sides in this war. On one team, you've got the aggressors. We're talking stomach acid, digestive enzymes, and yeah, even certain infections and drugs can join this team. But then on the other side, you have the protectors, a thick layer of mucus, a neutralizing substance called bicarbonate, and healthy blood flow that's always trying to repair things. Ulcers happen when team aggressor just completely overpowers team protector. So the big question is, what gives the aggressors the upper hand? What comes along and just rips up this delicate peace treaty that's supposed to exist inside your gut? Well, it turns out, for most people, and this might surprise you, it's not stress or spicy food, even though that's what we all tend to think. The science is pretty clear on this. It points to two major players. The overwhelming majority of peptic ulcers are caused by one of two things, either a bacterial infection called H. pylori or from using common pain relievers, NSAIDs. So let's put these two main suspects under the microscope. First up, we have public enemy number one, a little spiral-shaped bacterium called Helicobacter pylori. This thing is a master of survival. It's incredibly well adapted to live in the super hostile, acidic world of the human stomach. And yeah, it's responsible for the lion's share of ulcers out there. And H. pylori is seriously clever. Here's its game plan. First, it produces this enzyme called urease, which creates ammonia. Why? To neutralize the acid right around it, basically building itself a safe little bubble to live in. Then it starts releasing toxins that directly damage your stomach's lining. And to top it all off, this provokes a chronic inflammatory response from your own immune system, which just ends up causing even more damage over the long haul. Okay, so the second major culprit isn't an outside invader. It's actually something many of us take willingly, maybe even have in our medicine cabinets right now. Non-steroidal anti-inflammatory drugs, or NSAIDs. We're talking about super common over-the-counter meds like aspirin and ibuprofen. So how can a pain reliever cause this kind of harm? Well, NSAIDs are fantastic at reducing pain and inflammation, and they do that by blocking these chemicals called prostaglandins. Here's the catch, though. Those exact same prostaglandins are absolutely vital for keeping the stomach's protective mucus barrier thick and for maintaining healthy blood flow. So when you take an NSAID, it's kind of like you're accidentally turning off the main security system for your stomach lining. Okay, so we know the main culprits. But how do doctors actually figure out what's going on? Well, it's a bit like detective work, honestly. And it all starts with the clues that the patient's own symptoms provide. The timing of the pain is itself a massive clue. For instance, if the pain gets worse right after you eat, that often suggests a gastric ulcer, one that's actually in the stomach. But what if the pain doesn't show up for a few hours and eating actually makes it feel better? That's a classic sign pointing towards a duodenal ulcer, which is in that first section of the small intestine, just past the stomach. Now, while most ulcer pain is a kind of chronic, gnawing issue, there are some really critical red flags you need to know about. Symptoms like these are serious. They could mean there's a major complication, like bleeding or even a perforation, which is literally a hole in the stomach wall. If you see any of these, it's time to get immediate medical help. So symptoms can definitely point us in the right direction. They're great clues. But to get a definitive, 100% certain diagnosis, to actually see the ulcer with their own eyes, doctors rely on one gold standard procedure. That procedure is the upper GI endoscopy. It's basically a thin, flexible camera that lets a doctor look directly inside your stomach and duodenum.
And this is so powerful because they don't just see the ulcer and confirm where it is. They can also take tiny tissue samples, called biopsies, to test for H. pylori right then and there. And, really importantly, they can rule out cancer, which is a crucial step, especially for ulcers found in the stomach.
Okay, so here's the really good news in all of this. Once an ulcer is diagnosed, it's highly treatable. The whole goal is to call a truce in that internal war we've been talking about, to quiet things down and let your body's amazing natural healing processes take over. Modern treatment really boils down to 3 clear goals. Number 1, relieve those awful, painful symptoms. Number 2, heal the ulcer that's already there. And number 3, and this is arguably the most important one, make sure it never ever comes back. The absolute cornerstone of treatment today is a class of drugs called proton pump inhibitors, or PPIs for short. And these things are incredibly effective. Why? Because they literally shut down the tiny pumps in your stomach wall that churn out acid. By doing that, they create a much more peaceful, low-acid environment where the ulcer can finally heal. But beyond PPIs, there's a whole arsenal of other treatments. You've got antacids, right? They give you that quick, temporary relief by just neutralizing the acid that's already sloshing around. H2 blockers are an older type of drug that also reduces acid. And of course, for any ulcer caused by H. pylori, the absolute key is eradication therapy. That's a combination of antibiotics plus a PPI to completely wipe out the bacteria for good. So, healing the ulcer is one thing, but keeping it from ever coming back, that's a whole other ballgame. And this is where your lifestyle and your personal choices play such a vital role in maintaining that internal truce for the long haul. Really, it all comes down to keeping those aggressive factors in check. So avoiding NSAIDs whenever you can is huge. We know that smoking and too much alcohol can mess with the healing process and even increase acid. And if you are infected, making absolutely sure that H. pylori is completely gone is without a doubt the single most important thing you can do to stop it from returning. So when you think about it, modern medicine has given us these incredibly powerful tools to win the battle against peptic ulcers. But this leaves us with a final thought, right? Even with all these amazing drugs, preventing that war from ever starting up again, well, that often comes down to our own daily choices. It just goes to show you that powerful partnership between medical science and our own personal responsibility for our health.